Hi, my name's Shauna and I'll be demoing a central line dressing change on a PICC line. So first thing we do is go ahead and check our order and check the MAR and check if there's any allergies or sensitivities. Our patient does have an allergy to morphine, but we are not giving any medications, therefore we're all good. So then I'd go ahead and gather all my supplies. So first I need my clean gloves, I need a tape measure, I need a mask for my patient, I need my hand sanitizer, I have my central line dressing change kit. I also have extra sterile gloves and an extra Tegaderm dressing. So now that I have that, let's go on in and meet the patient. Hi Mary, my name's Shauna. I'll be your nurse today. I'm just going to go ahead and pull the curtain and set my things down and wash my hands. Can you go ahead and give me your full name and date of birth? Good. So full name Mary Smith and date of birth 5/18/63, like on her wristband. So I'm going to go ahead and be changing that PICC line dressing for you. Have you had that done before? Okay, you have, so you understand that we got to keep everything nice and clean and you got to hold still so we don't introduce any bacteria or infection. So I'm going to go ahead and wash my hands. And I'm just going to begin by opening up my kit and sterilely pulling away from me. Trying to make that cooperate. And I'm going to go ahead and wash my hands again before touching anything in the kit. I'm going to carefully pull my mask out. And I'm going to go ahead and apply my mask. And then before anything else would come out, I'm going to go ahead and wash my hands. Trying not to reach over my kit, kind of going around. And I'm going to go ahead and ask the patient if they're okay to wear a mask for the duration of this procedure. And if they're not able to turn their head away from the dressing change. And then I'd go ahead and wash my hands. And now I'm going to go ahead and put my clean gloves on. And just start by inspecting the PICC line here. So she has a double lumen PICC line. And we're just going to take a peek at it and check for Rita. So any redness, edema, ecchymosis, drainage or approximation. And that all looks good. And then I'm going to go ahead and palpate for tenderness just to see if any areas are tender from around the insertion site. And she said those are all good. Now I'm going to go ahead and take some measurements. So my first measurement, I'm going to go 6 inches above the insertion site. And I'm going to measure the circumference of the arm. And I would note that if it's a ½ inch greater than the original documentation, that could be a sign of infiltration, and I'd notify the provider immediately. I'm also going to measure the external length of the catheter from the insertion site to the cap. And then I'd note that as well because it can have the same findings if it's greater than a ½ inch, or meaning that it's getting pulled out or shoved in too far. And we don't want that to happen. I would also note that these caps would be changed per agency protocol along with the dressing change. And now I'm going to go ahead and peel back this dressing. So you start in the corners and you peel back very carefully towards the insertion site. And you would go ahead and make sure not to touch the skin underneath. You want to keep everything as sterile and clean as you can while changing. And if this were an elderly person or someone with fragile skin, I would go ahead and use an alcohol swab to help loosen the dressing up so we're not tugging on their skin. And if this was a small child, I would go ahead and have the parents sit in here with them and hold them and talk to them, or even use a little doll and show them on the doll that we're just changing a dressing, that we're not doing any poking. And that's also a distraction method. So as we're pulling back here, I'm just going towards the insertion site here. And just being careful not to tug too hard, don't want to pull anything out. But noting that there's usually, PICC lines are usually sutured in. I would note any drainage on the dressing, any color, odor, the consistency, and the amount, if any. I'm also going to take a look at the hub, at the insertion site in the hub, make sure nothing looks out of place or any additional drainage. I would note if there's a stabilization device in place there, and also noting on the dressing if there was like a chlorhexidine piece in the middle or any type of antimicrobial piece. And now I'm going to go ahead and remove my gloves, and I'm going to wash my hands. And now I'm going to go ahead and pull my sterile gloves out. Just very carefully. And without turning my back anywhere, I'm going to go ahead and open those up. And of course, one would stick. And just very carefully. Okay, noting that I would just get a new pair of sterile gloves if that happened. So I'd wash my hands. Get my new sterile gloves. Carefully open up. And then, as best I can, to hook it. And then to insert my hand in there. And then twist it around. And then to hook on the inside of this guy and pull it down. And then first thing I'm going to do is to take my alcohol swab and just carefully swab around the insertion site in a circular motion and working my way out to remove any excess blood, drainage, and get that area nice and clean. Next, I'm going to take my chlorhexidine and my forceps and go ahead and activate that, and very carefully lifting that up. I'm going to work my way around, going in a back and forth motion to create friction, and doing that for at least 30 seconds and allowing it to dry completely. And then I'd be done with that. And then after that's dry, I'd take my skin prep and go ahead and lift these up again and go all the way around the skin for added protection. And then drop those. And then using a no-touch method, very carefully peeling back the dressing. And then as carefully as you can, centering that. And go ahead and pushing that down. And then I'm going to go ahead and remove the paper. Very carefully pushing down if anything looks like it's popping up. Be careful not to touch the underside. And then I'm going to go ahead and take a piece of tape. And I'm just going to secure the base, because that's where it can get ripped up and introduce infection. And then I would take an additional piece of tape, and I'd write my initials, the date and time of the dressing change. And then I'd go ahead and remove my gloves, and I'd wash my hands. And then I'd go ahead and remove my mask. I'd wash my hands. And then I'd go ahead and remove my patient's mask and wash my hands again. And then I would make sure my patient is safe, comfortable, bed's in the lowest position, and they have their call light. And then I'd go ahead and clean up my supplies, wash my hands on the way out. And then I would go ahead and document the date and time of the dressing change, noting any drainage or any deviations from the measurements that I had taken. Also, if there's any stabilization devices or the chlorhexidine patch, and also noting that if the injection caps were changed, if that was per my facility's policy. Thank you.